1 million people trapped in the war zone that is Gaza are facing yet another killer on top of bombs and bullets, starvation. We're now witnessing a deadly surge in malnutrition-related deaths. As you know, mass starvation means starvation of a large proportion of a population. And a large proportion of a population of Gaza is starving. I don't know what you would call it other than mass starvation. And it's man-made. And that's very clear. And this is because of blockade. And I have said it in my statement, more than 80 days of blockade straight. And then, of course, there is opening now, but it's not enough. It's just a trickle, and people are starving.
That was the Director General of the World Health Organization yesterday in Geneva, warning of the growing humanitarian crisis in Gaza. Let's face it, it's been growing for a very long time. Yesterday, we reported on the joint statement signed by more than 100 aid groups, urging Israel to allow for greater aid distribution into the enclave, as Gazans desperately need food and supplies. With us now, Caroline Willeman, project coordinator for the international charity Doctors Without Borders, who works in Gaza. Thank you so much for being with us, Caroline. You know, every time this story comes up, every time you try to have a discussion about this story in the United States, in the West, you have supporters of Israel, which I've always considered myself a supporter of Israel, but you have certain supporters of Israel saying, oh, this is just Hamas propaganda. Talk about how we're hearing this from all these aid groups, from the International Red Cross, from the Red Crescent, from the United Nations, that this is not Hamas talking about this. These are the very aid groups that have saved lives across the world for decades now.
No, absolutely. I can only echo what we just heard Dr. Tedros of the World Health Organization say. I see this with my own eyes every single day. We run a primary healthcare clinic here in Gaza City, where the number of patients who are enrolled in our malnutrition program, these are children under the age of 5, as well as pregnant women, their number has increased fourfold in the last 2 months. We are enrolling 25 new patients every single day, and that's only a primary healthcare center. We are by no means the biggest provider of assistance for people who are malnourished here in Gaza. The situation is absolutely catastrophic. I have been doing this work for 9 years. Never in my life have I come to work meeting my own colleagues who come to work hungry. My own colleagues, they have a job, they have an income. They have been coming to work earlier this week, not having eaten 24 hours or 48 hours. Yet they come and do their work because there is no other choice. They are the ones propping up what is left of the Gazan healthcare system, but it's not tenable. We will not be able to keep going if the healthcare workers themselves, among with the rest of the Palestinian people of Gaza, are not able to eat.
Yeah, Claire McCaskill is with us and has a question. Claire, though, I just want to say really quickly, what we just heard echoes what we heard a few days ago from the International Red Cross, who said journalists are going to work hungry, and here we have aid workers going to work hungry, and nobody is suggesting that they're suffering as badly as the Gazan people. But this shows you, though, I mean, this hasn't happened before, where food is so scarce in a region that support staff and people reporting on this tragedy are going hungry themselves.
Yeah, it's really a head scratcher. Is this a strategy? And that's what I would ask you, as somebody who's worked in this field for as long as you have. We know how to feed people in crisis in this world. We've done it many, many times. What is the barrier? What is happening? Why are people being killed while they're trying to seek aid? I don't understand how this furthers the goal of the Netanyahu government in terms of making sure they disable and wipe out Hamas. I can't understand why this is such a roadblock. Can you shed any light on that?
I mean, is this a strategy? Absolutely. I mean, that's the only thing that we see here. There is food a few kilometers from me. The Gaza Strip is exceptionally small. This is not a crop that has failed. This is a choice to deprive people from food. And as you say very correctly, it is a choice to shoot and kill and maim people who are desperately looking for aid. My own colleagues were in the emergency room earlier this week when dozens of dead and wounded arrived who had gone to the Zikim border crossing, which is in the north of the Gaza Strip. There had been trucks of the World Food Programme entering, and as these desperate people approached the trucks, they were shot dead. And we have been hearing the very same story every single day at the distribution sites of the so-called Gaza Humanitarian Foundation in the south of the Gaza Strip, where every single day people are being shot at and are being killed. So is this a strategy? Absolutely. And this is what we are seeing as part of, I cannot call it anything else, the genocidal campaign that is being waged by the Israeli authorities on the people of Gaza.
Caroline, could you talk about that a bit more, the combination of hunger and lethality, people trying to get food, going places to try and get some sustenance and being shot at, aid workers being shot at, doctors being shot at. Could you talk a bit about what your eyes have seen?
Yeah. So, I mean, obviously, I know a lot through my Palestinian colleagues. People know very well that they risk their life when they go to these distribution points. But when you have not been able to feed your child several days in a row, it's pure desperation that pushes people to do this. A colleague of mine lost her brother-in-law earlier this week. The son of another colleague of mine went to this distribution where 79 people were killed. He came home empty-handed, and the drama is that coming home empty-handed, he somehow needs to be grateful that he survived. And this is the daily question for people here in Gaza. How will I get food? And again, the same applies to my own colleagues. My own colleagues, they have a salary. They have a job, they have a salary, but the very, very little that is left in the markets is so excessively expensive that even they cannot feed themselves and their family every single day. It is not possible.
Project coordinator for Doctors Without Borders, Carolyn Williman. Carolyn, thank you for joining us today, and most of all, thank you and your colleagues for the work that you're doing.